Okay, today is August 12th, 2019, Monday. It's about 1:07 p.m. And with the help of my mom, I look I look a lot better. I feel some better. I want to try to get this video done as quickly as I possibly can because I am in a tremendous amount of pain. And let's talk about the reason why that I'm in. I thought I was comfortable, but it's hard to get comfortable when yeah. Okay, hang on, folks. Hang with me. I'll try to. I'm going to tell you where things are at, and I also am going to be doing this as an educational piece that is also a documentary. I am the owner and founder of Knoweth and its sister organization WOETH, which is National Organization for the Ethical Treatment of Humans. WOETH is World Organization for the Ethical Treatment of Humans. And in 2004, I was well on my way of getting this organization up, rolling, going. We were doing very, very well until cases that I got involved with, especially with when it comes to medicine. It's something that the affairs of medicine in the United States is in great disarray. And actually, the ones who are at fault for this is, one, attorneys. I have said that, we have enough health medically licensed. I don't like calling them healthcare professionals. I don't like saying doctors or physician because it's like if you say that, then there's this mentality that, wait a minute, I'm a doctor. I'm not like that. And so it's best to avoid that mentality and say the medically licensed. Okay. We have enough medically licensed in the United States. What we don't have, unfortunately, is enough malpractice, medical negligence attorneys. And the reason for this is pretty much simple, that when you have states that are like the medical licensing boards who are not willing to enforce laws with those who are the nefarious medically licensed. So we are making a division and understanding here who we're talking about. It has, there was one point that in the state of Oklahoma, I worked with a gentleman that was absolutely, what makes you feel very proud of your state and proud that you are working with people like this in your state and of your state. And but unfortunately, that Steve left, and there was quite a considerable number of changeovers in there, and so it's just a runaway train. The problem has gotten so big that the state offices can't handle it. And so they don't want to hear it. And unfortunately, because they don't want to hear it, we've got the nefarious medically licensed that are absolutely saturating our health profession here in the United States. It is an absolute runaway train. And It's unfortunate that there are those of us who have been fighting this infraction that we have suddenly find ourselves not having the backing that we should have. And now that's being seen now because it's gotten bad enough that now everybody is affected. There is nobody in the United States where you are a client or if you're in a medically licensed that this has not touched, that it does not involve. And fortunately that it is this way because this means that there are people who are coming together and working together with our leaders. We do have leaders who are wanting to hear from us. And of course, now there's something that we have seen going on that there are those in the office that are undermining certain leaders to where that they are not being able to get calls from those of us who have been working with them. And when you got somebody who is controlling that switchboard, you're trying to get past that. Good luck. Because I'll make this known right now. Attorney General Mike Hunter, I have praised him. I have worked with him and his staff. Recently, I made a call to speak with the staff and or with Mike, and this guy who answered the phone answered it like I was calling his house. And when I asked to speak with one of the staff or Mike Hunter, he told me that's not going to happen. Excuse me? That's not going to happen. Well, it has happened. It's happened several times. Well, no, it's not going to happen this time. And that's what happened with the Oklahoma Medical Licensing Board in January of 2017 when they just started dumping all pain clinics clients. I was in it. I had a perfectly good reputation. My records, absolutely the best. I'm exactly the type of client that any health professional would want. I'm not doing anything with my medicine. My medicine is being used for what it was made for. And that's the way that it stays. That's the way it always has been. And of course, that's the way it has with the majority of clients who go in. We only got those 1%ers who unfortunately get a script here and there. And which, okay, that's no big deal, except that it's become a big deal in the sense that they're looking at the streets and then pointing the fingers at the doctor's office. And of course, we know it's not where it belongs. So now the problem is, got as many of you have been following, I have doctors who are been playing enough games that I cannot get this elbow and this I cannot get the elbow put back into place for one. So the elbow has been dislocated since June 20th, 2019. Then it was re-injured in a fall again on July 21st, 2019. And I had an emergency room doctor who on the x-rays looked at the x-rays with me, is the only doctor who has looked at the x-rays with me, spotted a tumor on the bone in the elbow. And the radiologist did not catch that, does not direct to it, which is, I've got so many x-rays with me, my mother, and friends where that radiologist, that's where one of the biggest problem is radiologists. And I hate to say it, this is my field, but I know my field. That's where a whole lot of work needs to be pointing to, being looked at, because it's amazing at what the radiologists, how much lying. They're just out lying. They are not acknowledging what the problems are, and they're very obvious. They don't care. And it seems like, why do they not care? They don't have to care. Why don't they have to care? Because there's no law forcing them to care. You have to. And of course, also now, I'll tell you all this, that speaking outside of Oklahoma, I am speaking with people in very interesting positions who have stated that here in the United States, there are doctors who are so angry with the insurance companies because of the premiums that they're having to pay that they are actually doing damage to people so that they will be sued and the insurance company has to pay out all that money. And so here we are, we're caught in the middle. Great. Well, there's nothing that is more binding than having a film where you're seeing broken bones or you're seeing large tumors like mine. I got one that's 2.5 foot long. It's almost like they hire around God, whoever you want to check and all, Shemanfere, Gabriel, Michael, any of these are going, how much more obvious do we have to make this before that those who are in positions that are supposed to be helping to stop this kind of trespasses violations? What does it take? How much more obvious? You take this in, there you go. There's a lawsuit. But not here. Not in a lot of states anymore. We need laws. This is one of the things that I was pushing for, and I still am adamant about, and that is that we are reporting in the offices. Absolutely. Because I tell you right now, it's the only way that we are going to be able to get the medically licensed to be honest. Now, I am not able, nobody's doing anything right now. Here's the games that has been played with me. Let's get into this right quick because I don't want this being long. I had an x-ray tech at an ER that was fighting with the staff for calling him in at 3:30 in the morning to come in and take these x-rays, find out how much damage, how many broken bones, etc., etc. And absolutely got into quite a fight with the staff. I had quite a time with him. He was very aggressive. He was ill handling of me. He was making mistakes. He was pushing and pulling, and I wanted away from him. When we got done with the x-rays, I was out that door, wanting him to get away from me. It had a security officer that showed up when I was telling him to get away from me. And as soon as that security officer showed up, I went to, of course, to my emergency room, and we could hear him fighting. And it was quite a fight out there. And it lasted a good 20, 30 minutes. And I was told that he was fired as of that particular time. And it was mostly because of the way that what he did with the staff. Of course, some with me, but it was the greatest with the staff. He didn't want to do the job that he was hired to do and wanted to complain about it, throw a fit about it. And Anyway, and so the surgeon, the orthopedic surgeon, had promised that we would go over the x-rays so that we would know exactly what to do. He's going to go over everything with me because I want to know exactly what we're going to do before we do that surgery that I am in agreement with, and post surgical care. Sorry, I'm having a little bit of thyroid problem, and so it makes me very dry. Hopefully, tart candy helps. So suddenly, I was on a Sunday evening. Monday morning, I was directed to my orthopedic surgeon. Suddenly, that I have to get a cardiology clearance. I have to see a cardiologist because the amount of pain that I was being forced to deal with, I was not having, of course, proper pain management. And so it was causing heart problems. My heart was beating so hard, you can literally see my shirt shake. When over the years, when my heart does that, I'm in too much pain. Every time that my heart gets to where that it's pounding like this, I have been in too much pain for too long. And of course, that means cardiac damage. And they did 2 tests on the troponin on me. It told me, well, it coagulated and it gave a high reading of troponin, which meant that I was having cardiac damage. EKGs had been showing. I had a paramedic an ambulance take me to the ER here a week before that. I'm in too much pain. I'm not being treated properly, correctly. And I'm also having pulmonary problems because I'm not breathing right. And so he tells me I have to have cardiology pulmonary clearance and I have to have a pain management, not just a physician, a pain management specialist and anesthesiologist. Surgery's not going to happen. He'll refer me to OU. And I know exactly what he just did. That he's going to refer me to OU. He just told me his opinion of OU. And he told me his opinion of Baptist Hospital in Oklahoma City. And so he's off. He's not doing the surgery. Okay, now then. Over a week later, my cell phone goes out. And so I call the landline. I call my doctor's offices and stuff and tell them, use the landline, go by it. My other phone is out. And so it was a week later, I think, what was it, August? It was late August. It was a Tuesday morning. I get at 9:15 a.m., I get a phone call, and this person is asking me, did you know that you had an appointment at 8 a.m. with an orthopedic doctor? No, I didn't know that. Well, you missed that appointment at 8 a.m. I said, how could I have missed it? I was never informed about it. So then it took about a week for the parts, what I needed, to come in for the phone. On the voicemail, I hear a hospital is asking me if I am still on for the surgery on August 1st by a Dr. Gordon. And at this point, when I'm hearing this message, it's August 4th. Yeah, it's August 4th. I'm hearing this message. They had a surgery set up for me, to which I never got a call from the office, from the staff, no consult, no nothing, no calling the other number, nothing. So here's the games that are getting played. And so now, what this tells me is this. Hang on a second. That I know that air conditioner is probably blowing across there, maybe distorting sound. Oh, jeez. In a minute. Okay, where was I at? Okay, now they're caused me problems, and they caused me problems with my primary doctor now. That's what they've done. They've caused me problems now with my primary doctor, because now I missed an orthopedic appointment, and then I missed an orthopedic surgery, and so they're after me. This is all my fault because they failed. I tried to get my orthopedic surgeon to put me in the hospital so we can get this pain under control. We can get the cardiac tended to, the pulmonary tended to. I had already contacted my insurance company. They had no problems for them to even put me in for pain management with this type of an injury. I can be in there as long as the doctor deemed fit. And I said, even if that's a month, and they said, however long, whatever it takes to fix this and get you going good, yes, you're covered. So I want to point that out because there are doctors out there who are lying their butts off about your insurance clearance, or you got to have prior authorization. When it comes to especially injuries that come to your medical needs, absolutely, especially if you're Medicare, you don't need a prior authorization for any MRI. Don't let any doctor tell you that. That is an outright lie. They're going to lie to you like that. Tell them, oh, I've already talked with them. I already know the laws. Just say that. I already know. I've already had it explained to me that in Medicare that I do not need a prior authorization for either and for a diagnosis that I've already had or a suspicion of a new diagnosis that is needed to be revealed, sought after, diagnosed. Doesn't matter. You do not have to get a prior authorization on that. And it's just amazing that how many doctors will tell you that. Now, my orthopedic surgeon told me that they would only allow me to be in there for 24 hours. And I said, I've already spoke with Medicare. I know that they've already prior authorized a stay for however long that I need it. And I said, I'm just not going in there for pain management. I said, I need my lungs worked on, having breathing treatments and stuff to finish getting this infection out of my lungs so my lungs are good. We got enough days. At the time, we had 5 to 6 days. That would have been long enough for me to be lined out. My body is ready for the surgery. And we can have the MRI, find out if I got the tumor, if there is a tumor on there, or as if there is a shadow effect that is making the bone appear to have a tumor in it. Because an ER doctor, I agree with the ER doctor. It absolutely looks like there's a tumor in the bone, and in the bone that he was wanting to drive the shaft of a joint into. He was refusing to go over the films with me. He had made it to where that there was no way this surgery was going to happen. And I had thought that he was a really good doctor, and the staff was great. The staff was really great. But for some reason, I really don't understand this right now. I don't know if I ever get to the bottom of it. That he decided that he just did not want to work with me. He did not want us looking at the break together, because the proximal end of the radius bone, that is broken off. And there is a surgery what they call twine binding, which is basically kind of like having a couple small little nails in both sides of the bone, and then they take this wire and they connect it, and they twist that wire, pulls that bone into alignment, wonderfully secure. It's very little metal in there. You're not drilling holes into the bone to do a plate. You're not hammering in a shaft of a metal joint into the bone. And with the twine binding, that is very easy to remove. And I need something like that because metal has a tendency to not do well in my body, and they have to go in and they have to remove the plates and the screws. But this is not something that he was listening to. He told me, no, 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 gotta put a joint in. We haven't even done an MRI. We haven't even done an MRI to find out the ligament damage, the tendon damage. He told me that I had tendons in the wrist, hand, that have pulled away from the bone. And how they know that is because you can easily see the bone fragments in the general x-ray itself. But he says he doesn't think that he wants to do surgery on that, put that back together. After a while the pain will dissipate, which you're talking maybe a year or two it will take. And yet that won't ever go away because that's bone. It's a free moving, jagged bone, kind of like the elbow where that proximal bone is broke off, and it's got those jagged teeth on it. So every movement, there's tendons and there's tissue, blood vessels, and the blood tests show that considerable soft tissue damage. They would not let me get a copy of the blood test results, which was very illegal of them to do, because you can request to have copies of everything, all the tests, everything, before you leave an emergency room. And so when they were refusing to give me those results, I knew that there was significant damage, because I was asking them, I kept pushing, how come that my body would have this huge area, looks like flash burns all over my body, all over. I don't know. I said, well, generally that's a sign of severe inflammation. I said, there's a system going off. I said, probably the immune system that is knowing that there's some damage going on. Of course, now there is bone marrow. The bone is broken, so I've got all kinds of anatomy flowing out of the bone, out of bone marrow. They don't know why. And in their hands is a test result showing why. And they're ignoring all of this. And so here's another case that is validating how bad medicine has become in the United States. We are literally a third world country at this time. Medically speaking, we are a third world country. And they sure shut my rights organization down, because if it had been able to carry on, we would not have, things would have not gotten this far. And of course, they always come after the one who is having the most impact and success of helping people, because I've done a lot to help people have good medicine and pain management. Yes, I am. And I tell you what, I'll let anybody who thinks they want to challenge that, come on. Come on. Come sit down and talk with me. Come talk with me. I want to hear what you got to say. I want to hear about how what you think you know what's going on in my life. How you think that all these people who are supposed to be doing their job, what they took an oath to do no harm, to help heal, to follow the law, to care for. You come talk to me about, while they're doing this, this is all you. No, it's not all me. No, it's not. You know why it happens? Because they think that people are not that educated. And they're very upset over the fact that people are very educated. They are very knowledgeable. They are researching. Nobody wants to walk in and go, okay, doc, whatever you want to do. No, no. People aren't, people aren't accepting that anymore. And there are those out there that's what they want you to do. You let them do whatever they want to do, or otherwise you're not going to get any help. Or when they do help you, what they do is illegal. And so by the time that everything is said and done, your problems are a lot worse. And it's amazing. It's amazing that how many of the medically licensed. I had one here. I'll give you a good example right quick, and then I'm going to stop this. I'll give you a good example. I went to this one specialist, and the particular problem that I had going on, this specialist wanted to send me to this one particular medical facility in Oklahoma City. And I had asked about, is there anyone else that I could be sent to for this type of treatment that you're speaking of? No, this is the only people, the only ones that we have in Oklahoma City that can do this particular type of treatment. And I said, well, I cannot go there. I said, well, I have to find some other place. I said, it doesn't matter, if it's in maybe Tulsa or another state. When they asked, why is it that I would not want to go there? And I said, I'll be perfectly honest with you. I said, I had two doctors several years that I went to that would not believe that I have a extensive background in medicine, especially radiology. And when we were looking at the MRIs, that I had set them up on the view boxes, and he comes in and he looks at it and he says, now this is the way that I like to see my films right here. He said, this is exactly the way that MRIs are to be put up, just like this. And he says, this, my staff knows how I like to have things done. I said, your staff didn't do that. And he looks at me. He said, what do you mean my staff didn't do that? I said, I'm the one that put those up there. And I said, yes, I told you. One of my doctorates was in radiology. I can read films. I can interpret medical terminology. And at that point, he turns around and walks off. And I get sent to go to this doctor that is right there, same level. That doctor comes in, and I should have recorded. But anyway, when I found out that I had the level of knowledge that I have, they cut everything, and I was on my own. And that doctor told me that she was done seeing me. She says there's nothing else she can do for me, and there's no charge for the visit. And so, like so many times, they're just going to have to get used to it, aren't they? They just need to get out of there, get their big boys and big girls pants on, and get over it. People are very educated, and we need all of us. We need all of us to come together on this. Share this video. Know your rights when you go into a doctor's office. Otherwise, it's you're going to end up like me. You're going to have an arm that is like this. I walk with a limp on my left because I had 4 broken bones in my left foot when I helped rescue Great Plains Regional Hospital from a hostile takeover, and I suddenly found myself without any doctors. They wanted to bury me on that, and I bought my own walking boot cast, and I had to take care of it. So I lost mobility with it. But this is a lot worse because I got a dislocation in this elbow along with the breaks and the fractures. And so, isn't this something? Here we go. This is American medicine. Somebody who knows medicine very well can't get proper medical care. If I can't get it, I know exactly what is happening with everyone else. And it's for that right there is the reason why that I have stayed on this computer, that I share my knowledge, I talk with people, I send people to the best people that I know that is trustworthy to help get things done, because you got to know people who are that will help. You've got to know medically licensed people who will help others. And these are areas of specialty. So it means that this is very limited. Unfortunately, that's the way it is right now. It's very limited. And we got to know, we got to share who is helping and who isn't helping. And we've got to get our leaders to mandate a law. I want you guys fighting for this. Mandate these laws, not only to have every room with video and audio recording, that every procedure, every surgery, every consultation is video audio recorded, and when you leave, that you are given a disc of those recordings, and you have everybody gets the first copy of their medical records free. And now the next part, which is really needed, push for having a law that any doctor who abruptly tries to end your care, that you can immediately call the police, and this is to be looked upon as if you got somebody standing there with a knife or gun to you. Because ending your medical care just even stopping certain medicines is no, they advise not to do it because of the fatalities that they cause. So we know that ending, just stopping medicine has killed people. Absolutely. Otherwise it would not, there wouldn't be a warning to it. And we know that if you stop medical care, yeah, people die from that too. So that is actually threatening your life. That is also terroristic threat. So there should be a law to where you can call a police officer in, and it can be right now, this person's care is going to be continued until this gets sorted out, and or until we get this person to someone who will take over, not just anybody, but someone who will properly care, resume the care, meet the care needs of that person. These are the only two ways that I know of that is going to be able to self-police what's going on, to unload the amount of suits that are clogging up our court system, and that is burdening our agents in our state and federal offices. It's the only way that I know. And why not? They've got cameras on every street corner, every street light, every building. They're watching us. Let us watch them. And also have it that all doctors, all medically licensed must take, and I would have every morning that they come in, that they do a UA test on them to make sure that what is in their system is meant to be in their system. And I think it's a good idea also to have drug testing in our city, county, state, and federal offices. Absolutely. And do it on a regular basis, because there are a lot of things that are going on that tells us that this isn't level-headed thinking. Especially when you come in with thinking, this type of thinking that's with these six words, has done a tremendous amount of damage because of what others have done. There is no way that any of us will get proper medical care with those. It should never have been allowed to come in. Oh yeah, well, I'm going to treat you according to all these other people. Well, you'll never get to me. What do you mean? And I said this with the doctor. You'll never get to my files. Well, I got them right here. I said, no, you might have them in your hand, but you got everybody else's file on top of mine. And so you're looking at everybody else because of what others have done. You're never going to get to me. You're never going to be able to look at what my file says because you're going by what others have done. There's only been a few times that I've had doctors or a medically licensed person snap out of it, shake that off and go, you're right. We got that lined out because of what others have done. That should have never, ever been permitted to be in the thinking, being among any aspect of the medically licensed. And I'm going to stop right there because I'm getting very tired and I'm having a hard time speaking through this pain. But I want to get this out. Right now, I'm on my own. I got to figure out where I can go. If there's any place that I can go, because any place I go, I will need to have records sent to them, which will mean that these nefarious ones will know where I'm going. And I've got to come up with a way to sidestep that. So right now, I'm living with a dislocated elbow, a broken bone in the radius, fractures in the distal radius and ulna, fractures, broken tendons in the thumb and the fifth metatarsal, this is your fifth metatarsal right here. Your radius is your thumb, is on the side of your thumb. The ulnar bone is on the side of your little pinky. So there are fractures that they've seen here as well. So I don't know what I'm going to do. I'm trying to come up with something, somewhere. So if you would, keep me in your prayers. If you know someone, an orthopedic surgeon, that we have a good one, please let me know. Please let me know. And do please share this. Share this. And also for Medicare clients, I want to add this for you because this is something that isn't as well known. When you go into an emergency room, Medicare has a law that states that if you got a treating physician, that you can have that treating physician can direct, guide the ER in what they want, how they want you treated. Whatever test they want done, whatever medication they want given, doesn't matter. That your treating physician can direct of them, and that emergency room is actually obligated to follow through. They are also obligated to contact your treating physician. But I'm going to tell you what's one of the best things to do is before you go to the ER or on your way to the emergency room or while you're sitting in the ER, before you're back there, before you get back in the ER, speak with your treating physician and or their staff. Let them know you're going to the ER, and so that they can either call the ER or know that they should be getting a call. And if they are not getting a call, then you call them, and you call them or they call you, whatever. But know that that is a law, that your insurance will back you, and this is an insurance law in Medicare, that you can have your treating physician so you're not at the mercy of these ER doctors, because a lot of ER doctors, or a lot of ERs are not willing to be very cooperative when it comes to pain management and other things. But that is a way out to be able, a way to get the ER to help you. Okay? And you can call Medicare and ask them, they'll tell you absolutely that's true. Okay? That is true. Don't let them tell you that it's not, because I've had ERs try that with me, and they learned very quickly that that is a law with Medicare. You can get Medicare on the line even. You're going in during working hours. I would, if they wanted to fight me on it, I'd get Medicare in line here. Okay, that is a law. Know that. So I wish you all keep in the fight. Let's keep this going. Let's keep sharing each other's story. Get this out. Send this in to media, social medias. Help this to go viral. Because I tell you, I know this is a truth now, and I want this known. It needs to be kept known, and that is that I have joined the ranks of other caring health professionals that coming up with natural medicines that have worked so well for people. And as many of you know, the glucosamine chondroitin, and I'm going to say this right quick because this is going out. Glucosamine chondroitin, you got to have both ingredients. You want triple strength, which is, you'll see 1,500 milligrams. You should see both 1,500 and 1,200. You got the right strength. That's triple strength. Works the best. Double strength works well. Single, you'll never get where you need to be. Okay, here's how you take it. Here's the key. 4 capsules, 3 times daily for 3 days. Now, you want to eat a couple crackers, a slice of toast, maybe a couple of cookies, something. You do not want to take this on an empty tummy because it will make you queasy. Okay, third morning is always the big relief morning. All of a sudden, you're waking up, you got mobility, fluid mobility in your joints. The pain, I've had people tell me that profoundly decreased for some, totally stopped their pain. And I've had people that have been bedridden. I had one gentleman that told me that his mother, her life was either bed or in a chair. That was it. What she missed most was her garden, her flower gardens. And when he followed, I wrote it out for him. We were happened to be in this line at a store, and I was listening to him tell this to a cashier. So I wrote this out, and and he happened to be in the store that I went into, and was thanking me. He says, "I want to thank you for what you did for my mother." I said, "Well, how did that go for you, brother?" He says, "Well," he says, you know, she's in her flower beds and she's shopping and she's, going to visit friends and church. He goes, well, you know, she's on the go so much, I'm having a hard time keeping up with her. I said, well, that's pretty good. That's a pretty good problem to have. And another testimony is a woman of 27 years of age was scheduled in 6 weeks for a double knee transplant. 4 weeks later, she calls me up. She says, I thought you would like to know how this went. I said, sure, tell me. She says, well, it's like a miracle. I never thought my knees would feel this good again, ever feel this good again. She says, the doctors and the surgeon has canceled the surgery, and is actually telling other patients about it. And I said, telling other clients about it? She says, yes. That's a miracle. That's really cool. Now, on your maintenance dose, find out what it is. I'll give you an example. You can take 2 twice a day, 3 once a day, or as needed. It's for rheumatoid arthritis, bursitis, carpal tunnel, tendonitis. Now, osteoarthritis, um, you've lost cartilage at that point. That's not going to help the joints that have osteoarthritis. Now, read the ingredients. If it has titanium dioxide, that's a paint derivative. Aluminum anything. Aluminum suppresses the immune system and is a neurotoxin. Now, disclaimer. This is always seek your doctors for medical care and advice. This is not to take the place of your treating doctors, but your treatments or any health medically licensed that you seek. It is not to take the place of that. So always seek your doctors for your medical care. And because of this that I've been under attack over it. And so much that I've actually I had one doctor in 2017 contact the team of doctors that I had put together, that I had worked a year to put together. And all of a sudden, after he phoned them, I no longer had them. And so I'm paying a very high price. But medicine is for healing, helping, and caring. And that's what I fell in love with. And I'm going to stand with that. I will do whatever I can to help. I will use my medical knowledge. I will share it. I will share it. Because I don't like seeing people suffer. And my mother, she's one of my best clients. She's 82, and she's she's up doing pretty much whatever she wants to, and she gets sassy every now and then with me, which is that's okay unless she thinks that she is thinks that she can just be a little bit too much with me. She give me that evil eye, you know. No, no, natural medicines. You know, thankfully, President Trump has passed a ruling making it to where it protects all medically licensed to be able to direct people of natural medicines that are very beneficial and not be harassed, nor the clients be harassed. And that is a much needed ruling. And this is the reason why I'm talking about it. Because without that, now we've got something to help protect us. Because as I just told you, that there are these nefarious medically licensed people. And that one that called up my team, my medical team, I was in the hospital. And he was one of the specialists called in. And when he found out that I was treating my Crohn's successfully with over the counter natural products, he overdosed me on a pharmaceutical. And if I had not had a carrying medical license tech, if I had not had that person present when what he did to me was killing me, I was on my way out. That tech contacted the crash team, and fortunately, I already had an IV established. And just as my respiration, my lungs went out, I was paralyzed. I couldn't breathe, and I was on that part of blacking out. I was going. This is it. And they slammed that reversal drug in me, and then all of a sudden, I took in a breath and I could breathe again. And so he knew what he had done, and so he contacted the team of doctors that I had because that's one of the drawbacks of having a computer system where doctors can access your files, know everything about you, that they can do you real harm. There needs to be better laws protecting us from just any medically licensed people accessing our information. So I'm stopping here, and I hope this benefits helps you all. And if you would, please pass around my story, my case, my videos. I can't type anymore. It puts me in too much greater pain. And if you have a talk show that you would like to have me on, absolutely. I've done lots of talk shows. Um, I'm a big advocate on this. And if you would like to know my story, know the pharmaceutical companies that I have worked with, cases that I have been involved with, absolutely, absolutely be very happy to share them. So, everyone, I hope that you are doing better. I hope that you are hopeful that we are able to get some things being turned around where medicine is getting back where it needs to be with us. And if there's something that I can do, you have my contact or to message me. I will absolutely do whatever I can to help. And so, God bless you all. Take care. Much love to everyone. Namaste. Namaste, everyone.